All right. So I already looked at Heather's shoulder about 2 weeks ago. Had a several dislocation history. Luckily, everything in there in the rotator cuff looks great. So we talked about just doing an intra-articular steroid injection to calm down the pain in the shoulder. And then we're actually going to work together to work on some stability for her functional movements that she likes to do, like the dynamic gymnastics and CrossFit and snatches, to be able to get back to that. Okay, and then I'm also going to go over what I like to do for dry needling of the shoulder specifically. I see a ton of people who want that done, and targeting all those muscles that end up getting aggravated or really, really tight, pretty much with any shoulder injury, making sure those are nice and released so they can do better rehab, have better movement. Okay?
I don't have any pain in my shoulder though.
That's okay.
Is that okay?
Yeah.
Okay.
You volunteered for this. So we've got humeral head there. I guess you can't put that right there. Okay. Here's a little bit of the labrum that we can see, the glenoid. Okay, and then we have the infra. So you can do a little external rotation for us. Okay, so we can see the shoulder move. Okay, we got a little bit of abnormal movement there. My eyes are just picking that up from seeing, and also her shoulder swivels in the joint, so it has a little bit of movement when she's trying to do that stuff. Okay, good. All right. So what we're going to do is try to get into that space right in between the labrum here and the humeral head. Okay, because this is a deep joint, we just have to use the longer needle.
Great.
Okay, so we're going to do poke.
No, but like I'm fine.
Good and okay. All right. Pushing in that fluid. Yeah. Okay. All right. So pretty easy procedure, right? You guys want to try next? Okay. Do you mind putting that on the holder for me? Yeah.
Can you visualize?
Can you see the tear on there?
Yes, not well, but the hip joint itself, fluid coming into it, you can see really well.
I might have to come see you for my old lady hip.
Yes.
20 years of soccer. It's kind of.
Hips another one where people wait a really long time to see me for their hips, and their first hip injection, they're like, "Oh my God, you changed my life."
Yeah.
That one is really easy.
It's not always bad.
Okay, so there's a couple spots I really like to hit for the shoulder. Okay, the first one's actually the external rotators. So what most people will do is their external rotators will get really, really tight because they're trying to compensate, just like they're trapped. And these muscles tend to get weak. Okay, so then that pulley system that the rotator cuff needs is not working, so it's getting more and more aggravated. Okay, so sorry, I usually go this way. All right, so what I do is I try to feel where that muscle is really, really stringy, and then into that tendon itself, okay? Once I find the spot I want to hit, I like to hold it between my fingers. You guys can get closer too if you want for this part. And then, are you guys going to learn dry needling now that it's an option? Yeah? Okay, great. So then once I'm here, I put a lot of pressure with the cap so that they don't feel the pain as much. Poke it in. Okay, and then once I'm in here, we do what we call pistoning. So I want, nice nervy. Sometimes it feels really nervy if you haven't had it done yet. Okay, and then sometimes we'll get some spasms. Usually I'll go in there a good amount as long as they're tolerating it well. How was that? Okay. You hate it? Okay. Yeah. So the scap's here. If I don't feel it, there's always the risk that there's a hole in the scap. But you should, based on the patient, you can kind of feel, okay, I should be able to get in this far. So usually do 1 or 2 here, the next one a little bit closer to the tendon. And again, you really want to make sure you like hold it so you know where it is, so it doesn't slide on you. Okay, and then we'll go in there. Got a little spasm. Right. Next, I'll hit the trap. For this one, I like to hold it. If you've done any training, they always put the fear of God in you that this is going to release and you're going to hit the lung. So it's also great too because I know that I've hit the depth I want because I'm going to feel the pressure of the needle on my fingers on the other side. Okay, so we'll come in here. And there's some people where their trap will try to escape you. It'll try to pull out of your hand. Okay, so we'll again do the same thing, that pistoning here. If they're also having neck pain, I might go into the levator scap as well. But I usually hit 2 spots on the trap. Doing okay? Got some good spasms in there. Okay. All right, and then I'll have you flip. Hit onto your belly, onto your back.
Do you tend to always include dry needling whenever you're doing therapy?
Yes, because nearly everybody's going to have compensatory mechanisms that have already began, and so even from myself, whenever I have a shoulder injury, I know right away because my neck starts to hurt, right? I start to shrug, I start to pull. So if you do the whole release, not just release the shoulder, but also release the muscles, they're just going to rehab better. Okay, and then the other big one, so go ahead and scoot that way just a touch for me, that I'll get is the lat. And then also like really deep in here, sorry, ticklish. And then a little bit of the subscap or that kind of anterior part of the scapula. There's a really hot spot there. I can't quite figure out what insertion it is, but when you've had the pain, you know it. And you're like, I can't get it. It's a really, really great spot to dry needle. And then depending on the person, they might also have some like pec tightness happening or some deltoids, so I'll hit all of those. But my general 3 that I go to are the 2 on the back and the 2 in the front. So we'll go through that really quick.
Man, I'm sorry.
You doing okay? What? Oh.
I just thought I was going to get like a couple pokes. Actually, just the whole right side of your body.
Yeah, you're going to feel great.
Sorry, I don't even know if I shaved my armpit.
No, you're totally, trust me, you're fine. All right. Okay, so we're going to get that lat first. Yep, and you might need to invest in longer needles for certain people because you might get hubbed. Okay, and then we'll do that one hot spot for you.
Am I like tensing up?
No, you're doing great.
Okay. I'm trying to just be chill. Oh, fun.
You're doing great.
There you go, good. You just relax, nice.
Get some tingles
Oh. No, I just had a big muscle spasm though.
Yeah.
Just grabbing them, you know?
Yeah, and you'll see sometimes when you're in a really bad spot, it takes a little bit of force to get through it with the needle. Okay, there you go. All right. Yep, so that's usually what I do, and then if I know I'm going to do a really intense treatment, then I might have them do crossover first to show them those before, because some people don't want to move their arm after this, and you don't want to activate them. You can do like a really light activation, but a lot of times I think about it as like you just relaxed everything and try to just set it a little bit. Very important, don't do anything after dry needling. If you've ever had dry needling done, you'll feel really great or loosened up. And if you exercise that day, everything you just loosened up gets twice as tight. And the patient will be so mad. Okay, so I tell them like, please don't do anything at all. Next day you're totally fine. But that day, you're all those like things that were protecting you are now gone. So you're gonna get worse the next day. Doing okay? Okay. All right.
Thank you so much.
Yeah.
Appreciate it.
Yeah. Cool. Any other questions? Good.